Okay, so today we're going to be talking about Chapter 19. And Chapter 19 is in your dental radiography textbook, and it starts on page 197. So Chapter 19 talks about the Bitewing technique. And this is a bite wing is a type of x-ray that you probably had if you've ever gone to the dentist and you've had a dental checkup or a dental cleaning. So what we're going to be learning about is what the purpose of the Bitewing image is, and what are the recommended settings for vertical and horizontal angulations for Bitewing exposures, and what are the purpose for taking a vertical Bitewing. We're going to be learning about the concepts, some of the step-by-step procedures, some of the different Bitewings that we take, and then some of the modification techniques and why we would modify certain Bitewing images. So the Bitewing is a method used to examine interproximal surfaces of the teeth. If you're new to dentistry, this is an interproximal surface is in between the teeth. And this is areas, or these are areas that would are prone to getting cavities or decay. And this is in between the teeth or in the flossing spaces where you wouldn't normally be able to see the cavities unless you have a digital image or an x-ray like a Bitewing x-ray. So some of the terminology that you're going to want to know are blue bolded on the bottoms of page 197 and 198. So interproximal talks about or refers to the areas in between the teeth that touch each other. An interproximal examination is just an examination where those areas are examined. A Bitewing receptor is going to be your x-ray film or your x-ray sensor that you'll be used to take your Bitewing or any x-rays. And you'll practice both of these in labs. And the alveolar bone is the bone that supports and encases the roots of the teeth. The crestal bone refers to the coronal portion of alveolar bone found between the teeth, also known as the alveolar crest. The contact areas are the areas between the teeth or the areas where the two teeth touch. And these are the areas that you're going to want to have opened in your x-ray. Contacts that have overlapping are going to be, you're going to have overlapping in your Bitewings. There's going to almost look like that ghostly shadow or image between the teeth. Overlapped contacts prevent the dentist from clearly looking between the teeth to make sure that there's going to be no cavities there. So you're definitely going to want to have open contacts in your Bitewing x-rays as opposed to overlapped contacts. So how do we take Bitewings? Well, these are the principles of the Bitewing technique found on page 198. And there are also some pictures here that I hope help kind of give you an example of what it is that we're talking about here. So whether you're using an x-ray film or a sensor, the receptor is placed in the mouth parallel to the crowns of both of the upper and lower teeth. So that is what a Bitewing is. It's an x-ray where the patient bites down on the Bitewing tab, and that's going to allow you to capture the crowns of the teeth, not necessarily the roots or any other parts of the tooth like we'll take in other x-rays. So the receptor is stabilized when the patient bites down on the Bitewing tab. The Bitewing tab is going to be like a piece of cardstock paper that your patient's going to bite down that's connected to your sensor or your film, or some type of beam alignment device, which is a plastic device that your sensor or film is placed inside of. The central ray, which is the main part of the x-ray beam, it's going to be directed through the contacts of the teeth using a positive 10-degree vertical angulation. Some people will use a 0-degree angulation, and that's fine. A positive 10-degree angulation is just another technique that we'll go over in lab. So a Bitewing beam alignment device is a device used to position an intraoral receptor in the mouth that the patient will bite on. It's also connected to a ring or an aiming device that you'll use in order to aim the PID or the x-ray tube against the patient face so that it gives you a perfect x-ray. A Bitewing tab accomplishes the same thing, except it's the heavy paperboard tab or a loop fitted around the periapical receptor and used to stabilize the receptor during the exposure. This isn't going to have an aiming device that you'll use. So a Bitewing tab is something that you'll use once you become more comfortable with the RIN device or the Bitewing beam alignment device that allows you to align the beam so that it gives you that perfect X-ray. So in lab, you'll be using both devices, starting off with the RIN or the alignment device. And then once you get more comfortable with that, you'll end up with using the Bitewing tab. So this next slide refers to the Bitewing receptors and the sizes that we use for each of them. You'll want to make sure that you study these because these are going to be on the test. So there's different sizes for Bitewing receptors, and you're going to be using different sizes for different size patient. So for example, your size 0 are for posterior teeth of children with primary dentition. Size 1 is going to be for the posterior teeth of children with mixed dentition. And size 2 you're going to use for the posterior or back teeth of adults. And this can be placed horizontally or vertically. And size 3 are for Bitewings, not recommended for adult patients. The size 3 isn't very common, and in fact, it's not really used anymore, but it does exist, and you may find it in some of your offices that like to use that. The angulation for your PID or your position indicating device is going to be important, and you'll want to know this. For Bitewings, the horizontal angulation is going to be most important, but there's going to be the vertical angulation is also slightly important as well. A correct horizontal angulation is when the central ray is directed perpendicular or straight up against the curvature of the arch and through the contact areas or flossing areas of the teeth. If we don't angle our PAD from side to side or mesial to distal angulation correctly, this is when we end up with overlapping contacts in our Bitewings. This is not useful to the dentist. It's not diagnostic, and it is something that we would have to retake again so that we can get the correct information over to the dentist so that he or she can make a correct treatment plan for the patient. So vertical angulation is an up and down angulation that we're going to use to position the PID. So in radiography, sometimes we have some terms that are a little bit opposite. So a positive angulation, for example, is when the PID is positioned above the occlusal plane and the central ray is directed downward. This will give us a positive angle. A negative angulation is when the PID is positioned below the occlusal plane and the central ray is directed upward. This gives us a negative angulation. For vertical angulation, the book says the correct vertical angulation is a positive 10 degree. Like I said earlier, a 0 degree is fine. You can use that. A positive 10 degree is going to give you a more crisp image. An incorrect vertical angulation will result in a distorted image. So there are some rules of the Bitewing technique, and they're going to be shown on the bottom of page 201. So the first rule that's going to be important is how you place the film or sensor. So the Bitewing receptor is going to be placed behind the teeth that are going to be captured. So typically in dentistry, for an adult, we're going to be taking 4 Bitewing X-ray images. 2 of them are going to be for the 2 premolars that are directly behind the canine, and the other two are going to be for the 2 molars that are behind the premolars. The receptor position must be positioned so that they are parallel to the crowns of both maxillary and mandibular teeth. The Bitewing tab or the bite block on the beam alignment device is what's going to stabilize the receptor once the patient bites down on it. Again, the vertical angulation is going to be positioned so that it's plus 10 degrees or so that it's just positioned slightly downwards. There's actually a picture on page 202, I believe it's figure 19-9, and it shows you a picture of a patient, and it gives you the different angulation or vertical angulation that'll hopefully make this make it a little bit more sense. With horizontal angulation, again, you're going to want to aim that center beam of the PID so that it runs perpendicular with your receptor in between the contacts of the teeth, so that you open up those contacts and give the dentist a view of in between the teeth. Currently, this is the only way that we can diagnose decay or cavities from happening between the teeth. Receptor exposure means that you want to aim the PID so that it's centered on the receptor. This will ensure that the receptor is completely exposed by the PID. If you don't center the PID on the receptor, what happens is you end up with something called a cone cut or a collimator cutoff, which simply means that the PID wasn't centered on the receptor. So some of the step-by-step procedures, first and foremost, you're going to prepare your patient by placing a lead apron above them, on top of them. There's some research out there that tells that placing the lead apron over a patient is no longer necessary because of the reduced exposure time and the reduced radiation that comes out of digital x-rays. There isn't this type of research isn't confirmed, and so just to be safe, we're always going to want to still protect our patients with that lead apron. In fact, in lab, we're going to want to protect our dexters with that lead apron just to get you in the habit of always making sure that your patient has that protection. Next, you're going to want to get your equipment ready. So if you're going to be using those aiming devices like the Ren XCPs, you're going to want to have them in the room ready for your patient, but don't open them until the patient is in front of you. This will show the patient that it hasn't been used on anybody but them since they were opened. If you're using films or sensors, you're going to want to make sure that they are both placed on, or either one of them is placed on your holder or your Bitewing tabs with gloves in front of the patient. Exposure sequence just means that you're going to want to have a preset order of how you take the x-rays or where you're going to be placing your receptor first and last. Having an exposure sequence will help the radiographer to have less errors, and then also it will help to not omit certain areas, as well as overexposing the same area twice. So in order to prepare your patient, you're first going to want to explain the x-ray process to your patient. After you learn this and you get into the groove of things, it's going to be it's going to be pretty routine to you, but to your patient, it might have been a while since they've been in the dental office, and you're just going to want to explain to them so that they're comfortable and they know what's going to happen. Next, you're going to want to position your patient so that they're upright in the chair, and also adjust the headrest so that their chin is level with the floor. Next, don't forget to place that lead apron on top of them and make sure that it has a thyroid collar. That thyroid collar is going to protect their thyroid, which is a very sensitive organ to radiation. Next, you're going to want to ask your patient to remove all objects from their mouth. This can be a retainer, a partial, a tongue piercing. All of these objects are typically made with metal, and if you have metal inside of their mouth, it's going to show up as bright white objects in their mouth that are going to block out anything that the dentist is going to want to see. So then you want to set your exposure factors. This will prevent you from jumping back and forth between the patient and the equipment. And then you want to open up the sterilized receptor package containing the beam alignment device in front of your patient and after it's been sterilized. 2 Bitewing receptors are typically exposed on each side of the arch. So these are the pictures that we talked about earlier, where you're going to have 2 premolar teeth on one x-ray film and then 2 molar teeth on the other on each side of the mouth. If your patient is missing some teeth, 1 Bitewing receptor may be sufficient. So use your best judgment on a situation like this. Again, our goal in radiography is to be able to get all the images that we need while still minimizing radiation exposure to our patient. CMRS stands for Complete Mouth Radiographic Series. So the book gives us some what they suggest should be the order of your series. So the first thing that you're going to want to do is expose all anterior periapical receptors first, then follow with posterior periapical receptors. So periapical refers to an image where you get the whole tooth from crown to root, and then you're going to finish with bite wing exposures. If you're doing a bite wing series only, you're going to expose a premolar bite wing receptor first because that's the easiest and less likely to make your patient gag. And then you're going to finish with the molar bite wing receptors last. This is what the book suggests. You're going to have your own, depending on which office you go to, different doctors want certain x-rays taken first. That kind of gets their whole diagnosing process going. And then when dealing with bite wings only, typically what I like to do is to expose the molar and then the premolar before moving on to the other side of the mouth. This will just prevent you from having to rearrange your PID and rearrange your patient, and that'll make it easier for you to get some really nice bite wing x-rays for your doctor. So the bite wing receptor placement is a specific area where the receptor must be positioned before the exposure. So this is going to be behind the teeth that you're going to want to be exposing, and this is dictated by the teeth and the surrounding structure. If you're using a film, the white side of the film is what faces the teeth. If you're using a sensor, the sensor will have a flat side, and then the back side is going to have like a cord or a wire. The flat side is the side that is going to be facing the teeth in a sensor. Typically in a posterior bite wing set, the receptors are placed horizontally in a horizontal manner behind the teeth. There is a dot on your x-ray film that the book says has no significance. I find that it is very helpful when you're trying to mount your series, so that when you're actually taking the x-ray, you want to make sure that you have that dot on the lower right. This will help you when you're mounting your series. Otherwise, it's going to get really confusing to figure out which teeth are which and which orientation they go. You're going to center the receptor over the area that's to be examined, and you're going to ask your patient to slowly bite on the bite wing tab or bite block of the beam alignment device. A vertical bite wing is used to examine the level of alveolar bone. This is done when you place the receptor in an up and down or vertical direction. This will help the dentist figure out if the patient has periodontal disease, and it can be done by being able to see the bone levels of both the maxillary and mandibular jaw. Sometimes we have to modify the way that we take x-rays depending on the patient's condition. Edentulous just means that the patient either has no teeth or they are missing teeth in a certain area where you're trying to take your bite wings. In this instance, a cotton roll can be placed in the area of the missing tooth to support the bite wing tab or beam alignment device. Sometimes patients have bony growths on the floor of the mandibular jaw called tori. If this is the case, the receptor must be placed between the tori and the tongue. So this gave us some info on the written slides of the Bitewing technique. I encourage you to look into your book. There's some very useful images there that kind of help you visualize what it is that we're talking about here. And they will also help you in lab when you go to place your sensors or your films, and also when you're placing your PID. All right, that's it for this chapter. Thanks for listening, and I will talk to you tomorrow.